Dr. Darien's here with us, and we are looking at a new study that examines endometriosis and cancer risk.
Yeah, so first we have to understand what endometriosis is. This is when the lining of the uterus, tissue, cells from that uterus end up in inappropriate places around the body. And those cells respond to the hormone changes that naturally occur during your menstrual cycle, and then those cells can grow and cause problems. Most commonly, pelvic pain, they can land in your lungs, and even in certain cases in the brain. In this study, they found that women who lived with this diagnosis had a significantly increased risk of ovarian cancer. We've known that this risk was associated, but in the study it showed that the risk was four times more, and in certain patients up to 18 times more.
Whoa.
So it's just a notice if you have this diagnosis to make sure that you're acknowledging your symptoms and getting the appropriate screening tests.
But it also takes a long time to kind of get this diagnosis
Yeah,
too, so it's good idea to be on guard for it.
Absolutely. On average, 7 years for someone to get this diagnosis. So it's important to understand, number one, making sure that you understand what your symptoms are. The most common is abnormal pain, abnormal bleeding, and if you have infertility, these are the type of diagnosis that you want to make sure you rule out.
Women live with pain all the time, though.
And that's, unfortunately, that is normalized. And I think that we as physicians and providers need to understand that no one should be living in pain. And when someone is, to address that appropriate pain and get to the bottom of it. And for a diagnosis like this, it requires intensive research and intensive discussions. But it's always important to continue to ask why until you understand fully what's going on.
And trust your gut if you're feeling the pain too.
Absolutely.
Right.
Dr. Darien, thank you.